Hi, my name is Rebecca Smith, Managing Director of Safe Hands, and welcome to the Safe Hands podcast. In honour of Breast Cancer Awareness Month, we wanted to have an in-depth conversation around this subject. And what better people to do this with than the fellow Safe Hands nurses? Hello, guys.
Hello.
Okay, so firstly, let me introduce you specifically to the other host today. So first up, we have Magda, who is responsible for the day-to-day running of all things Safe Hands related. Say hello, Magda.
Hello, everyone.
Okay, we have our lovely general nurse, Alys.
Hello, everyone.
And last but certainly not least, we have the newest addition to the Safe Hands family. We have Laura.
Hi.
Hi. It's good to have you on a podcast. I feel like it's just
nice.
another day in the
All of
office.
us together.
It's chilled. It's nice.
It is good.
You all look very pretty in your pink as well.
Thank you.
I knew that was coming.
Apart from you, Alys.
Alice.
What
I
colour is
tried.
that?
I tried. I'm
Your
not.
ribbon's pink, but what colour is that top?
Don't have a very pink wardrobe, so I tried with what I had to pink it up.
Okay.
You
well,
tried.
Yeah,
That's the important.
the awareness is there.
Try being the opportune word. Okay, we'll let you off. So you're looking pretty in pink. Obviously, Breast Cancer Awareness Month. Let's talk boobs. Okay. Let's do it. Okay. So firstly, before we delve into the topic of breast cancer specifically, we should probably address cancer, the C word. Okay. Does someone want to start by explaining what it is? What is cancer?
Yeah, so we definitely do have lots of cancers around, and many of us have been affected or know someone affected by cancer. But what is cancer? So cancer basically is a term of diseases in which abnormal cells divide without control, and that's when they can enter into nearby tissues, and also sometimes we see them being spread through the lymph nodes and the blood.
Okay. And what's the sort of prevalence when it comes to cancer? What are we looking at sort of globally and locally?
Yeah, so here, depending on where we are, but in specifically when it does come to breast cancer, it is quite high here in the UAE. But I'll pass it over to Laura. She's got all the stats in regards to
Hit us with the
breast
stats,
cancer
Laura.
specifically.
Hit us with the stats.
So breast cancer is the second most common cancer overall in the world,
Okay.
but breast cancer is the most common in females
Women.
worldwide. In the UAE, in particular, breast cancer makes up 22.4%
Wow.
of the overall cancers.
Okay.
This is in United Arab Emirates. In total, it increases every year by 0.3%.
Okay.
So it's not going down,
Yeah,
unfortunately.
it's going up.
Just gonna, hopefully it won't, but it is at the moment.
Okay.
Yeah.
So huge numbers there. Do you know anyone who's been touched by breast cancer? Do you have it in your families? Do you know anyone who suffered it?
My
No,
mother
touch wood.
actually had a scare once, but she had her biopsy and everything was fine. It all looked benign, so that's all good. But even my husband's mother, she had breast cancer.
Oh, really?
So it's not nice seeing the effects
No.
so close to home.
First
Certainly
hand.
not.
Yeah, and as you said, it's you have someone, whether it's family or friends, that's been affected by cancer. And for me in particular, when I worked in the hospital, lung hospital, you had a lot of people who were affected by breast cancer that led and travelled to the lung. So it's something you do see, and it is really hard. So if we can raise awareness and teach people what to do, to look out for, then we should absolutely do it.
It runs in my family. Apparently, I don't remember this, but when I was little, Panorama did a documentary on our family, and I was on the TV.
Oh, really?
Yeah, I was like 3 years old, feeding the ducks. Someone from Leeds did a documentary.
Look at you. You were meant to
so
be in
check
the
that
in the
out
limelight.
if you want. Look that up on YouTube. You'll probably find it somewhere. But yeah, it is super prevalent. And like I say, Breast Cancer Awareness Month. Let's delve specifically into that. Give us some risk factors. What are the main risk factors for breast cancer?
Yeah, so with our risk factors, obviously we have some that we can avoid and others that we're just not going to be able to avoid. So some of the unavoidable ones would be hereditary. So if it comes through our genetics, as we said, if it runs in the family, we're at higher chance, especially if it's someone closer to you, such as your mother, your sister. But then if it were your aunt, things like that, that decreases the chances slightly.
Okay.
Age as well. The older you get, the more prevalent it is,
Right.
as well as any personal history. So if you've previously had breast cancer, it could occur once again, and even just your breast in general. If you have denser breasts, you are at higher risk. And even if you've had any changes, so even if you have been diagnosed with benign things in your breasts as well, that puts you at a higher risk. Now, some avoidable risk factors that we come across, such as unhealthy lifestyle, drinking alcoholic beverages, smoking, all those kinds of things. If we're not doing that, that will decrease our risk factors. But even coming back to those genetics, so there are some things that we come across, such as the BRCA1 and 2. So it's a normal gene that all of us have a part of us, but depending on different people, we have a mutation. So if that mutation is present, 1 in 10 cases of breast cancer have that mutation.
Right, okay. Is that what Angelina Jolie had?
Yeah, so sometimes in cases such as that, you hear some people having both breasts removed, which is a mastectomy, because they just want to avoid that risk coming up in the future.
And is that sort of recommended if you have that gene, or is that someone just being sort of ultra cautious when it comes to being a carrier?
Yeah, I think it just comes up to the individual person. That I think, especially even if you have that carrier, I think if you haven't been around someone that has had breast cancer, then you may not have it at the forefront of your mind. But I think if you've experienced someone going through breast cancer and you find out you have that, that's going to be something you definitely...
If the option is to remove it completely and to avoid it, then you would, wouldn't you?
Yeah.
You do what it takes, don't you?
Yeah, exactly.
Definitely. I know if it was me. I mean, it's hard to say, having not experienced it. But I think if it were me, I'd definitely err on the side of caution when it comes to that. Okay. What are the sort of guidelines when it comes to getting checked, both sort of clinically and yourself?
Well, I think that it definitely starts at home. They recommend that a female and male, because it does, it does go both sides, but a female should be checking at least once a month. So at the same time every month. So it's something that you become really familiar with in your monthly calendar. So marking it on the calendar as well. They do advise that around the second to fifth day of a female's period, that it is the best time to check, because the lumps are less present and also they're less tender. There's many different checks that you can do at home, and that's by starting in the shower. So placing your hand behind your head and your elbow above your head, and just going around in a circle.
How was that? Placing your hand where?
Hand behind head and elbow behind above head. There you go. Did I get that?
Like that.
Yes, you got it.
You got it.
For anyone
There we
watching
go.
the video,
My demonstration.
there you go.
And by doing a circular motion and also inwards, but not forgetting also up around the armpit and the top area as well, because it's not just the tissue in the breast that could have a lump. Also, you could do laying down by placing a pillow behind your shoulder, because when you are laying down, the tissue is very evenly spread. And again, just feeling in that region and making sure. But the main thing that you're looking for, and this is why they say that you should have it do it once a month, is because you're coming to familiarise yourself with your own body and what's normal, because and doing it at the same time each month as well. That is a really important factor.
Question, be honest, do you do it? I
always do it during October.
I do it for the month of October.
It's great we have the awareness.
To be fair, that's the good thing about these periods, isn't it? These awareness months, because they do prompt you to think about it. But holding my hands up, I've never...
I thought you meant a period then. It's great having those as well. to be aware.
I wouldn't
remember
say
to
that
check,
that
yes.
is a sentence that would come out of my mouth. I do, as much as I appreciate the female cycle, I wouldn't
but
say
at
I'm
least
particularly appreciative.
It reminds you to check, right? It'll give you that reminder.
No, that's it. But I think it is something you have to create a habit with it, don't you? You have to do that with everything. So scheduling it, making sure it's part of your cycle, and it's something that you're doing on a regular basis is so important. And well, I've learned something today. I'm definitely going to go away and start thinking about myself.
Yeah.
Did you say you don't do it, Al?
No, not enough. not on a monthly basis. Certainly done it once or twice, but and wasn't doing the technique that you showed there. So I'll be checking in the shower.
Do you have to use the flat of your hand as well? I was always taught that you had to use the flat or not the fingertips. Is that still? That could be an old school method.
Yeah, I think it is the pads of your fingers. And I think you're doing it in the shower. It's easier to glide to be able to detect if there is any lumps or bumps.
Yeah. It's a good video.
We'll have to get
perhaps,
a video.
Perhaps maybe that's why it is a taboo topic sometimes, because it is a personal area that people don't like to potentially talk about. But it is something that we really have to, and you have to put it in the limelight and talk about it for that awareness to prevent possibly really bad circumstances from happening.
Definitely.
Yeah. Grab a feel, cop a feel,
exactly,
and make sure everything's normal.
Yeah, definitely.
Okay, we've covered how often you should check, how to do it at home. Got a few nice still shots of us sort of demonstrating position there. What's the sort of diagnosis for a lump, and how do they determine whether or not it's cancerous?
So then, let's say if we had done that self-examination and we're doing it regularly, and I felt a lump or any of those different things, and I thought there could be something there, then we would then go seek some advice from our doctor, and they would then, if they did think something were at risk or to check, they would either do a mammogram, which is an x-ray of the breasts, or they could do an ultrasound, MRI, and then if they did suspect something, they would then proceed to do a biopsy, because when they go and take a piece of the tissue and then be able to give you that result.
Okay.
And if any further tests are required, they'll also go forth and do that.
Okay. I think from the conversation I was having earlier, the turnaround time in terms of those tests and results is pretty quick out here as well.
It is, yeah.
And it's probably important to note that when it comes to checkups, I think there's a lot of sort of hospitals and clinics doing this free of charge.
Yeah, above an age, it is free of charge. 35.
They're the regular mammograms.
Exactly.
That's recommended. I think for people who don't have it on their medical insurance, though, I think there's some sort of initiative with certain hospitals and clinics.
Drop-ins.
Drop-ins. That's the one. So take advantage of that. And if it's something that you haven't done before, or even if you have, go get checked.
There's no harm going and having that second check.
No, exactly.
Check done.
Definitely not.
No.
Okay, so let's say, God forbid, it gets to the stage where you're diagnosed with breast cancer. What are the sort of treatment options we're looking at once diagnosed?
I think there's so many different treatment plans, and they're changing constantly with, talk of an immunisation coming out soon for breast cancer, but also the research that is being done all over the world changes those treatment plans. But there is surgery, we spoke about the mastectomy.
And often if you catch it early, then it is a case of just removing the lump or the node that they find. But of course, if it has spread further than that, then it would be looking at more in-depth sort of treatment, whether it's chemotherapy and other sorts of things. But it's dependent on what it is that the individual has, where it's gone to, which is again why it's super important to try and detect it early to avoid it from getting to that unwanted sort of treatment.
I suppose when it comes to breast cancer, it's slightly easier to detect than a lot of other cancers. Because you can feel it exactly. In a lot of cases, not all. So really important that it's caught at an early stage. What are the various stages of cancer?
Yeah, so the way they grade it for breast cancer is T and M.
Okay.
So what that basically stands for is tumour, node, and I'm going to say this wrong.
We talked about this earlier, didn't we? I've been saying it wrong.
Say it together.
Metastasis.
Metastasis. I've been calling it metastasis for my entire life.
And I'd say metastases.
Yeah,
so we're all
what
saying
do you say?
Metastases.
Oh. That's a new variation.
Metastasis.
That could be next podcast, we'll talk about that word.
Yeah. How to pronounce it. So that basically, our tumour T, so after they follow the T, it will be with a number ranging from 0 to 4, and that will indicate the size of the tumour.
Okay.
And then our N, standing for node, also will be followed by a number, 0 to 3, and that will indicate whether it has spread to your lymph nodes, and the larger the number will indicate the depth of the spread, and obviously if it is a 3, it would be quite far. And then M for metastasis, followed by a 0 or 1. So that would then indicate whether it's spread to your organs and your tissues.
Okay.
So 0, it hasn't. 1, it has spread to those following tissues or organs.
Okay, so super important that you get it before that stage.
Yeah.
I imagine when it gets to the M stage,
Yes.
metastasis,
Mm-hmm.
you know, it's harder to treat, right? We're looking at it traveling to other places in the body.
Definitely.
Okay. One last question that I want to cover for our listeners. A lot of people living in Dubai are away from home countries, support systems in terms of family and friends. What are the support groups that people can access out here?
Yeah, and I think you're so right. I think the importance to have a good support base for any treatment is vital to, a good outcome.
Yeah.
So being surrounded by family and friends, if it's not family, friends, or hopefully one or the other, to give you that positivity that you can get through and that you're not alone is really vital. But they've also have the Al Jazeera Foundation.
Yeah.
Al
Jazeera
Jazeera Foundation. There we go. Now we're even. And they're incredible. The ladies that and the gentlemen that run that foundation do support groups all through the year, not just this month. And they're also doing a lot of research. So they have coffee mornings support the women that have breast cancer. So it's really wonderful support. So if you don't have that family and friends, they're definitely a wonderful support base as well here.
Yeah. And often what's a big support out here that perhaps can be negative, but in this circumstance positive, is your Facebook groups. I'm sure if you put something out to one of your community group, there's bound to be someone who's gone through that. And we've seen the mums on there, and they are always really supportive, and they do answer questions. And if you find someone that's going through the same thing, that often helps in that situation.
Yeah, I think it's just opening up that conversation around.
Yeah.
I feel like when it comes to a lot of different illnesses, people sort of put a barrier up. I don't want to depress people with my talk of illness, okay? But it's important that people do chat about it, open up. And I think
it helps with recovery and healing as well by being positive in that and having others to support you. It helps your body heal and recover.
Yeah, and hearing those success stories as well.
Yeah.
People who've overcome this illness, taken on the fight with cancer and won. That's going to give you a positive outlook as well. So really important that people access the support, open up, have a conversation around it. And I'm sure we can post a link to some of those support groups.
Definitely.
I think we've covered the main bases there when it comes to boobs, as it were. Have you guys got any other sort of information to dazzle us with, or do you think we've covered all the topics?
Get them checked and and be positive as much as we are talking about really hard hitting things. And if anyone who is listening has gone through it, it is hard and it's not pleasant, but there are positive stories of people making full recovery from this. So it's maintaining that positivity and get yourself checked.
I think we should we'll post an image on our social media of how exactly to do those checks, lying down in the shower. So we'll post that material to support that, although we all did a great job.
I was going to say, wasn't not what I did.
It's a good demonstration. We'll post an image just to be sure, just to make sure, just to clarify and make sure everyone understands that. But thank you very much, guys, for coming on and chatting to me about that. Like I say, lovely to have you.
Thanks for having us.
Thank you.
Anytime, guys. Anytime you want to wander from that side of the office to this side to be on a podcast, you are more than welcome.
Just to have a little chat.
Yeah, chat it out. Well, thank you, guys. We'll leave it there for today's episode. As always, if you found benefit or you enjoyed the episode, let us know. DM us, send us an email, leave a comment. And stay tuned for the next episode.